Good afternoon, everyone. It's been a very long time since I've done a video. I've been very busy helping lots of people, but I want to continue to help you guys. So today I'm going to be teaching you a new tool. And this tool is very versatile. You can use this on just about anything. And I keep offering these kinds of tools to people, but not every tool is going to resonate with you. So the idea is I can give you lots of different ways of getting to the same conclusion. And what is that desired outcome that you want? Well, it depends on what's going on with you. If you're suffering from anxious states, we don't say anxious person, you're not identified as that. You are having anxious states and states to be changed. Same with depression, right? I am not depressed. I am not someone that has depression. I am someone that experiences depressive states, and those states can be changed when we learn how to do that. So this technique can be used on those kinds of things. It can be used also on pain, but I will put a caveat in there to say that when you are working with pain, there is a good chance that that pain signal has a purpose, because pain is not just happening for no reason. And you will want to make sure that you have addressed that and got it checked out before you just go ahead and try and switch off the signal. All right. So especially if it's something like a migraine or something that's been ongoing for a long time, your body is trying to tell you that there is something you need to be aware of. If you've been to the doctors, you've got it all checked out and you've got the green light and there's no reason for that pain to be there, either because it's something like arthritis that isn't going to get any better physically, but having that signal just telling you again and again that there is something going on there that you can't do anything about can be very uncomfortable, and therefore it would be nice if we could switch that signal off. And the good news for you is we can. So this is one way of doing such a thing. You can also do this if you're suffering potentially from panic attacks. It gives you something to focus on and you can actually reduce that. I wouldn't really say this is a go-to for panic attacks, but it's just letting you know that this is very versatile. So let's take something simple. Imagine that you are experiencing nervousness or anxiety in some way or form. This is called bilateral movement therapy. What does bilateral mean? It simply means that you're moving it from left to right in that bilateral way. Now, other techniques use this, things like eye movement therapy, EMDR, various other things. But today we're going to be using it to do with following the movement of an object. So you've got choices with this. You can either do what I do, which is use medicine balls. You can pick these up from Amazon for next to nothing or somewhere else. The good thing about these is they make a noise, right? So when you're passing it, you will hear it. And the idea of this is we want to engage at least 3 of your major senses, right? You're seeing, you're hearing, and you're feeling as you're passing that back. So let me tell you the science behind this. Most of us, especially men, are generally only using one side of the brain to process what they're doing. Women, and interestingly, left-handed men, we don't know why that is, are using both sides of the brain, but not at the same time. So what we're going to be doing is we're going to be stimulating both sides of the brain to be functioning at the same time. And down the center of your brain that connects those two hemispheres is something called the corpus callosum. Now, this is like a channel that runs down there that has over 300 million connections. And when we're stimulating both sides of the brain while we're doing this movement, we will basically getting the brain to get into a peak state, and it's going to be passing resources back and forth as we focus on a very specific issue that we're trying to solve, if you like. And therefore, it's going to resolve that so that the signal is no longer necessary, whether that's an emotion of anxiety or pain or anything else that you might be working on. So how do we do that? As I said, you can, if you don't have medicine balls, you can use a bunch of keys, right? That's just as efficient. So what we're going to be doing is we're going to be passing the keys, and we're not going to come past the center line with either of your hands. So what you're going to want to do is be passing the keys, and you're going to follow the keys with your eyes. But before we do any of that, we need to measure the emotion or the intensity of the sensations that you may be feeling before we start, so that we can get a sense that there is a difference. It's coming down each time we do this movement. So my suggestion is you take an inventory of your body, you go inward and you search for that feeling, and you'll notice. So if you're not feeling that feeling right now, you can simply think of the event or the memory that creates that in you. It could be something traumatic. It could be something that you worry about that hasn't happened yet. Trauma tends to be things about the past that's already happened. Anxiety is anticipating negatively the future. So if you're not feeling it now, then you need to think of something that, because the brain can't tell the difference if it's happening now or not, whether it's a past thing or a future thing. When you think about that, it plays the recipe in that order. I think about that, I think those things, and now I can feel those emotions. Now measure that. 0 being no emotion at all, 10 being a very strong emotion. Where is it within that scale? Once you have that, you can pick up your item, whether it's a medicine ball or some keys, and you're going to start to pass it back and forth. And you're going to follow the keys with your eyes as you're passing it left and right. And I want you to notice as you're doing that you can see the keys, you can hear the keys, and you can feel the keys passing back and forth between your two hands. And as you're doing that, all I want you to do is try to hang on to that feeling. Try and hang on to that. That feeling you had a moment ago, you're trying to hang on to that as you start to speed up. You're speeding up, really speeding up as you follow the keys with your eyes. Really speed up. Really trying to hang on to that. Ooh, and you might notice that you drop your keys, but that's absolutely fine. It's going to happen to you at some point. And then you keep going with it, speeding up as you try to hang on to that. And the harder you try to hang on to that, the harder it will be to find it. It just gets more and more because you're focusing all those resources in your brain at this issue, and then slow right down. You're slowing right down. Hopefully you haven't dropped your keys too many times or whatever it is you're finding, but that's absolutely normal and fine. And then once you slow down and you can't find that, you're just going to now put the hands down and you're going to take a nice big deep breath in. And just let it all go. Let all that tension go and just allow your body to process. Just give it a few moments as you breathe in. And it might help to go and think of the people that you love, the places that you love, their voices, the sounds, the feelings of all of that good stuff. And after you breathe and allow those positive changes to take place, I want you to just notice the difference. Where is that feeling? Where has that gone? And you may find it's come down by about half, right? And then if it has come down to half, I want you to just test it by trying to ramp it back up, and you'll notice that you can't. That's the wonderful thing about this. It's permanent changes until you just can't get it back. Now, you may be able to intensify it by maybe 1 or maybe even 2, but you can't get it back to, if it was a 10, you will not be able to get it back. The harder you try, the more you can't do that, right? So now we're at about 5. Maybe you can ramp it to a 6, but that's good because it tells us there's a little bit more to do. And it also tells us that we can't get it back the way it was before, which is very encouraging. So all you do is, again, you start as you try and hang on to that. You're passing it back and forth. You're hearing it, you're seeing it, you're feeling it, and then you speed it up again. Again and again and again, following it with your eyes as you do that, and then slow it right down. You're keeping your head still, but you're following the keys or whatever it is you're going, and then come to a complete stop after you've done that for a few minutes, and breathe in, and just let it all go. Making sure your arms and legs are uncrossed at all times while you're doing this technique. We don't want to cross the center line at any time. And again, just check in with yourself and notice the difference that difference makes. It will not feel the same. And the funny thing is, the harder you try, you cannot get it back. And you just repeat, rinse and repeat until it's gone. And it will be gone forever, whatever that might be. Unless if there's some pain there, that there's a reason for that pain to come back because you're doing something that's aggravated that again. But if that pain has no purpose, then it will not come back because it's unnecessary. So as long as you've checked all of that and you've been to the doctors and all the rest of it, and you know it's safe to let that go, it will be gone and it won't come back. Same for anything else you're experiencing. So that's bilateral movement therapy. It's very simple. And I've been using this a lot recently, and it's basically helping people that maybe are overthinkers, especially because it's impossible to do what you normally do while you're doing this. You're focusing so much resources, there's so much going on that the brain simply has to resolve that. It cannot be the same once you finish that, and it can be life-changing. So I encourage you to have a go at that, even if it's just for fun. And I will see you in the next video. All the best.